The functional zero is reached when a community's average housing placement rate is more than the number of people currently sleeping rough. And you can learn a lot more about functional zero model at the Adelaide Zero Project.org.au. Adelaide was the first Australian city to become a vanguard city through the Institute of Global Homelessness by making a commitment to end street homelessness within the Adelaide CBD. Adelaide Zero Project was launched in 2017 and the collective has achieved a number of significant milestones since then. So with the help of our backbone organisation, Dunstan Foundation, we established a collective governance structure, including an inner city community of practice of agencies across the sector who meet weekly to prioritise and coordinate secure housing for those people on our list. Led by the Hutt Street Centre, we ran Adelaide's first Connections Week in 2018, where over 200 volunteers connected with anyone sleeping rough in the city to understand their needs, their names, who they are, where they came from. Using this information, a live by name list was established, led by Neami, which the service providers now use daily to coordinate a housing and support those who are sleeping rough. We launched Adelaide's first public dashboard where we track progress each month towards functional zero, and of course COVID's been a little bit of a blip in that. And last year Adelaide became the first city outside Northern America to be certified by Community Solutions for having quality data in our by name list. We also opened additional temporary lower barrier accommodation led by Carrington Cottages, particularly for couples and for people with pets on the by name list, both of which tend to be barriers to accessing the services generally. And we work with those people to secure long-term housing while they're with us. Dunstan Foundation has also hosted Dame Louise Casey, and breaking news, she's actually just been offered a Baroness, so it will soon be Baroness Louise Casey, and Dr. Noni Brennan from the Institute of Global Homelessness to provide expert recommendations, which the Adelaide Zero Project is working through. Despite COVID-19, the Adelaide Zero Project is committed to reaching functional zero and ensuring long-term solutions for people sleeping rough in our city. Our current focus includes improving service coordination across homelessness, housing, health and correctional services, as well as other sectors. Prevention of homelessness, including scoping an emergency fund to prevent people sleeping rough or returning to homelessness after being housed, and improving a culturally appropriate responses for Aboriginal people experiencing homelessness or staying in Adelaide temporarily. We recognise that there are many forms and locations of homelessness. Our aim is to focus on rough sleeping in the inner CBD before sharing what we learn with other regions and groups experiencing homelessness. So very much a proof of concept model to show how we can actually work together and reform the system to better serve the people who are experiencing homelessness across South Australia. So I'd like to now introduce the rest of our panel and some of our key Adelaide Zero Project partners. We have Kim Holmes, State Manager from Neami National SA. We have Ian Cox, who is the head of the Office for Homelessness Sector Integration within the SA Housing Authority. And we have Dr. Selina Tually from the Australian Alliance for Social Enterprise at the University of South Australia. And while undertaking these introductions, I'll explain to you that for those of you who are outside South Australia, you're likely to hear the term SAHA referred to in today's discussion. SAHA is South Australian Housing Authority, which is a state government entity, and Ian is from there. I'll let each person introduce themselves and their organisation and flow straight into the first questions to make the most of our time together. So if you have any questions, feel free to use the chat function. So, Kim, I'd like to start with you. Can you tell us a bit about the Adelaide Zero Project and how the by name list has enabled rapid responses?
Sure, thank you, Louise. Just to introduce, well, obviously I'm the State Manager of Neami National. For those of you that don't know Neami, we've been a partner of the Adelaide Zero Project since its commencement. We're a specialist mental health service with an interest in and a commitment to working with homelessness, particularly rough sleepers, because of the strong interface between mental illness and rough sleeping. And we've been deeply involved in the response to COVID through our Street to Home program, which provides outreach, a hub service and case management and supporting people into their homes. So in response to your question, how the by name list has enabled this rapid responses, and particularly during the COVID period. In the year leading up to COVID, the Zero Project knew that we had about 150 to 160 people sleeping rough on any one night in the Adelaide CBD. We knew every month that there was an inflow of around 10 new people to rough sleeping. We also know the number that were moving into housing, that were allocated into housing or finding other solutions, how many people were in temporary shelter. And we shared a common assessment tool called the VITADAT, Vulnerability Index, which enables us together as a system and as a group of agencies to be able to assess and prioritise vulnerability, allocate housing according to priority, and also to put in place coordinated support for people, both as they're moving into their housing, but also while they're sleeping on the ground. So when we use the term by name list, it sounds like a simple thing. Sounds like we know we have this list of people and that we know everyone by name, and we know a little bit about their needs. But it is so much more than that. What it's enabled Adelaide to do is gain insights that we've never had before around the rough sleeping population. So we can collectively understand the size, the number of people that are sleeping rough at any one time. We can understand the issues. We can understand the systems and where people have come before they have moved into rough sleeping. And that way we can design solutions that respond in a much more targeted way that has an impact for people in the longer term. So when COVID hit and we moved into the state of emergency on the 23rd of March, was kicked off, we had already this very stable foundation and a whole lot of work that was in place over the 2 years leading up to the pandemic. And although the response was incredibly rapid and a little bit chaotic at times and overwhelming as well for the Zero Project and for all of the agencies that were involved, what it did mean was that we could mobilise really quickly. We could build on our existing systems, our collective approach. We could collect data and we could respond in a way that did enable us to, as a project, produce results. So what we know is that through the COVID response, 542 people, 511 adults and 31 children were supported with emergency accommodation through motels and hotels. We also know that during the height of the pandemic, at any one time there was around 310 people that were in emergency accommodation. To put that in context, what we knew leading into the pandemic was that we had that between 150 and 160 rough sleepers sleeping in the Adelaide CBD. So it told us something about the group that were rough sleeping and new people that came into the system. Through the COVID response, there was 67% of people that were new to the Adelaide region and new to the Zero Project. What we've also been able to do is collect data about what the outcomes have been. So we're now housed permanently over 200 people that came through the COVID response. And that's mostly been in the last 3 months. To put some context around that, in the year leading up to COVID, the Zero Project in total over the year permanently housed 124 people. So there's been this really rapid, intense response during the COVID period. What we know also is that predominantly people have been housed in public housing, so 140 of those outcomes have been public housing, 7 into community housing, and then we know 54 have gone into other types of housing as well, which is things like private rental, boarding houses where people can stay for a longer period of time. So as we sit here today, there's 55 people that are still in the hotels and motels under the COVID state of emergency. And at the end of June, we're yet to have our July data, but there was now 83 people that are rough sleeping and sleeping in the parks and streets. So there has been, we've got a long way to go to understand what this will mean in the longer term, but there has been an immediate, there has been a reduction of people that are sleeping in the parks and the streets. You know, and across the Zero Project, including this COVID period, we've built this incredible amount of information. That's just the tip of the iceberg that I've shared. We've got this information about people or in terms of where they've come from, their health needs, their support needs, and we'll talk a bit about that as the forum continues.
Thank you, Kim. I'd now like to introduce Ian Cox from the South Australian Housing Authority to tell us about their latest developments and what needs to be done to ensure people don't return to rough sleeping. So, Ian, how's the collaboration helped Adelaide to respond to the pandemic, and why do you think this has worked so well through the Adelaide Zero Project? You're on mute.
There you go. I meant to do that first up. Thanks, Louise, and hi to everyone as well out there. I guess the Zero Project's a really close to hand topic for myself as well. So I've been probably fortunate enough to have a look at homelessness across the world and also across Australia, and I think it's fabulous what we've got going in Adelaide as well. So look, in terms of the collaborative processes, the things that we've probably been fortunate in Adelaide, because we're a bit of a small city in some ways, and we certainly have got an advantage over other states as well, because we certainly know all the services, we know the people in the services, we certainly know our client group really well. Adelaide's beautifully set out in many ways, so if you just walk around the corner, I guess we're fortunate in some ways. We know many of the people who are using our services. I think a really interesting thing through COVID, it's probably enabled as well, I guess, us to look at our responses, not just in Adelaide, but across Australia. But we've also been able to converse with colleagues overseas. The beauty of Zoom and Teams is that we could have really interesting conversations with Chicago and Noni Brennan over there, and with Dame Louise in London, who I note as well is now a Baroness, so congratulations to Baroness Louise. But I think what I would hope into the future as well, that we're all going to be able to learn from what we've done really well in Adelaide. We can learn off other states, but we can also learn from others in different countries. That's going to be a really important thing for us moving forward as well. I think I'm really, I guess, in some ways proud to have been working within the authority, because I think what probably COVID did in some ways was that I hope we were working closely together, but it certainly really enhanced our relationships. And I think it actually brought the sector and government closer together. I like the fact that we could, not only are we involved with the AZP, but we could also give Louise and Peter a ring as the co-chairs and talk about, can we set up a COVID response in terms of just looking after the sector, having a sector pulse check on top of just the regular meetings as well, so that services were looking in and after each other all the way through that process. And I was really pleased to see that the authority certainly didn't wait for it. We responded. I think the fact that we've worked and accommodated so many people in such a short time, I think we've worked really well together. We're lucky that Adelaide has a really strong by name list, so we knew most people, but we also probably recognise we did see a lot of new people coming into the CBD, but at least we were able to then house people through the motel accommodation. And then just as pleasing, I think, in some ways, we could look at a couple of different responses. One, obviously, providing some funds for organisations so that we recognise with a really vulnerable group that if you house people, housing's not just the solution. We need to provide some longer term support. So just been able to give a few organisations 12 months of support funding. We know that that's going to have some learnings within that for us moving forward. But I think as well, just even the fact of with our, I guess, Aboriginal communities and people from remote communities, we were able to create a different response, and really pleased that Baptist Care could take on a lot of that group as well. At one stage there, we had over 70 remote Aboriginal women and children. I know that that was a fantastic experience for all, and I know that there were lots of really positive experiences through that. I think one of the other things with COVID is just, I think like Kim spoke about as well, data and evidence is we've all known that's a really big key area to resolving some of our issues moving forward, and it's even more critical, and we're able to hopefully as time goes just delve even deeper into our data and look at those links with health and justice, because we know that homeless services on the front line have been pretty well inundated with a whole bunch of new people, but we also recognise that people use multiple systems as well. So that'll be a fascinating bit of study for us all into the future about how can we, explore some of those, I guess, gaps, explore some of the opportunities into the future. And as I said, I think we know that prevention is going to be one of the key points if we're ever going to resolve homelessness. And I'm sort of really excited as well that that the authority, by hook or by, we're probably a little bit fortunate. There's a $20 million fund, and we put $6 million up front. So I know that I'm certainly not on that part of the panel, but I know that panel's working hard on assessing, I think it's just over 40 organisations and their bids to see what we can look at with preventative measures into the future. So that's probably just a quick little bit from me, other than I really enjoy the fact that the Zero Project's actually brought everyone together. I remember the early days when we had a few struggles and people were a little bit guarded about whether they wanted to be involved, but the fact that we have everyone there, the fact that we know everyone's name who becomes homeless in the CBD and the outer region, I think that's a fantastic starting point. We've got a lot of work still to do, but I congratulate all on what you've done as well.
Thanks, Ian. Now I'm going to go a little off script here just to keep you all on your toes. Sorry about that. We've got a couple of questions coming. Look, I'm going to firstly ask this one. Probably this is you, Ian. So we have Vesna Rosman, who I think I know is a former colleague of mine. I think she's out at Charles Sturt these days. What is the best way local councils can support reducing homelessness, especially because many homeless people do not actually sleep within the city centre, but rather in the suburbs? Have we got some advice for people in the suburbs and particularly in the council as to how they can assist with people who are homeless and sleeping out there?
Yeah, well, we're probably fortunate we do have some of our services out in those regions as well. And I spoke with one of the councils in the northern area recently. So there was a forum, they brought some of those specialist homelessness services together in the council area. So I would probably say that's probably one thing you can do as well. So we do recognise that whilst the Zero Project and Adelaide Zero Project is focusing on obviously on the CBD, but we do recognise that people sleep rough in a whole range of different regions. But I'd probably be contacting the authority and finding out who some of the specialist homelessness services are in those regions as well, and just exploring pathways and opportunities to see if you can access some of those services. And that seemed to work really well in the northern region, and we're able to get some sort of quick wins within that area too. So that would be probably one of my suggestions.
And is the Homelessness Gateway another way that they can access?
Yeah, absolutely. I mean, we call it sort of the access point now, but it is very much the two, certainly the two gateways in terms of the generic and youth services working together. And then we still have our, obviously, domestic family violence gateway.
Lovely. And if you Google those, the phone numbers will come up. We have a question from David Kelly. Kim, this one's probably for you. How do we ensure that the urgency and impact that has accompanied the housing response for rough sleepers during COVID is maintained and extended in the future?
I think that's a fantastic question, and I think for certainly from a Neami perspective, and you know, hopefully from a Zero Project perspective, we need to keep operating with the same level of urgency. What we've demonstrated through the COVID response is that this is not an individual issue. People do want help, they do want to be in emergency accommodation, and they do want permanent housing. Now, we know that there is also a group of people with complex needs, and that takes a significant amount of persistence and ongoing support, but there are solutions there, and there's system solutions. It's not about the individuals that are on the ground. So if there's something that I would really like to advocate through this forum is that we continue to operate with the same level of urgency. The sorts of things that we were able to put in place were daily allocations, coordinated health responses, coordinated care responses. We've worked really closely, the agencies along with SAHA, to really iron out some of the duplication and iron out some of the kinks between our homelessness services in the NGO sector and SAHA, and we've got a really efficient and a way that's working really well for allocating people to properties and supporting them into those properties. And the other thing that I would say is the support is incredibly important. We've done a piece of work through the Sears project, which has looked at 109 people and their housing and support needs. And what that demonstrates is that over 70% of people score a score of 10 or more on the VITADAT. Now, what that means is that housing is one thing. These are people, this is a group of people that need ongoing support to retain their tenancy. And also when we look at the group, 25% of that group were living on a disability support pension. They're living with a disability. There's over 80% of people are living with a mental illness, and that they respond saying that that has got in the way of them being able to maintain a tenancy. There are when 68% of people are living with trauma. The needs are complex and the support is really important. And I would absolutely concur with what David is asking, that the level of urgency needs to continue, not once we've got everyone out of the motels and hotels, but also with those 83 people that are still on the street and the 10 people that we know will continue to flow into rough sleeping. We need to keep operating with the same level of urgency. We know we can make a massive impact when we do that. It does make a difference.
Thanks, Kim. And look, I certainly agree. We always say that housing first is the gold standard, but we're not talking about housing only. It's definitely housing and supports. Yeah. So I'll follow on with that one. How have the people that we've been providing services to, the people experiencing homelessness, responded to what we've been providing, the solutions during COVID-19? And what are some of the challenges these people still continue to face? That's probably another one for you, Kim.
Yes. The response has been incredible, really moving for our teams that have been working with people that have been sleeping on the streets for sometimes years, who they've engaged and moved into hotels and motels and had this experience of one of our staff members, I think, they described it as almost being night and day. They hadn't worked in the service for some time. They knew a lot of the individuals when they were out on the street. They then got to engage and work with people when they're in hotels and motels, and with sleep, a safe roof over their head, a shower, food, feeling safe. It was like working with a different person that had the space to complete housing applications, to think about their future, to make plans, to engage and to work with our staff, and not just be operating on survival mode all of the time. So, you know, what people have told us has worked well for them is that there was low barrier to the emergency accommodation, that the hotels and motels were dignified. They couldn't believe the dignity, the lovely rooms that people had, and the hotels and motels being treated like a guest, being treated like a community member, with a high deal of respect. That made a massive difference for people. Also, we heard a lot of feedback from people about feeling cared for and feeling like that there was some hope. I remember speaking with an individual who's now in a home, who said he'd been sleeping on and off the streets for a number of years, and he could barely believe that, you know, in his words, government had responded in this way. He said, I thought we'd be forgotten. I thought that we'd be fending for ourselves, and we weren't. And his gratitude for the response, not only for him but for the people that he knew that were sleeping on the ground as well, was enormous. You know, yeah, and I think the other things that people said helped was that there were daily visits. Everyone was allocated a case manager, and we started, once people had some time, and we've done some education predominantly around the emergency response, which was the education around hygiene and isolation, and, you know, keeping distance, etc. That they could then work with our teams and start to think about their future. They all had a case manager providing options, guidance, etc. So it's made an enormous difference for a lot of people. And for some other individuals that we've been working with on the street for a number of years, the rapid response, the concerted effort, the level of urgency has also assisted some people that were sleeping rough, that were really unwell, and really difficult to engage into and work into, particularly mental health responses. The collective approach with Eastern Mental Health and DASA, the hospital avoidance team, has meant that there's been a number of people that we've been able to re-engage with mental health, that have moved into inpatient units, been able to recover and work on longer term responses as well. So it has been, it's been received really positively by the majority of people.
Thanks, Kim. Now, Kim, you mentioned about the VITADAT and the data, and I think that's an excellent lead into Selina Tually, Dr. Selina Tually from University of South Australia, who has been doing research on the data from our VITADAT by name list. So Selina, can you tell us a bit about the research and what the data tells us about those who are most vulnerable on our list?
Thanks, Louise. I sure can. Now, I am, the academic on the panel, so I am going to share a PowerPoint presentation. No surprises there. Okay. So the research I'm going to talk about now, and I am involved in a number of bits of research for the Zero Project, is actually on better understanding the people on that by name list that we have been talking about. I'm going to assume you can all see my screen. Yes, hello.
I can't see your screen. I'm not sure if the...
Oh, okay, hang on. Let's
no. Yes.
Have we got it now? Have you got me?
No, we've actually got the screen being shared. Yes, we can see you now.
Right. Sorry, that might have been my bad actually. Stop share, screen share. And I even tested this. Here we go. Now you got me. There we go. Well done, Selina. Okay, so the work I've been doing is obviously understanding the people on that by name list that we've been talking about. Now, this research was actually pre-COVID, but I think what has actually probably been really surprising for many of us and not surprising for many of us is how consistently the same vulnerabilities come up when you're talking about the group that have been supported through COVID and actually the group that have also been on the by name list from the start. And I know there's a couple of questions about data sitting in the chat box as well, and hopefully this will come some way to answering some of those things. So the task, as I said, was to try and look more deeply into the data that we have. And the data set that we do have is actually really powerful and really insightful, but it does have some limitations. It's a triage tool, so it's not a research data set. Which from a researcher's perspective is a little frustrating at times because it means we have some gaps in some of our understanding. However, we do have a huge amount of data there that tells us basically how we can solve rough sleeping in Adelaide. So the data that we looked at for this research in particular was September last year, and there were 199 people in that analysis. As Kim has said a couple of times, there was about 162 people actively rough sleeping, and then there was about 37 in temporary accommodation. So the project was really looking at acuity, so the intensity of people's needs in terms of support, and also inflow points to try and work out what we can do to intervene to increase the number of exits from street sleeping, and also to potentially start looking at how we can prevent people from tipping into that in the first instance. So this is a very complicated looking table. There's two triage tools that have been in play over the life of the project. They score differently, but basically, as Kim mentioned before, if you get a score of 10 or more on the current tool, you're considered high acuity, which really means that your needs are aligned to housing first. So a housing option with intensive supports for the term that you need those supports for. So the overall picture, exactly 3/4 of people have high acuity needs, which again tees up with what Kim just said about the Sears group at about 70%. So basically that means that there's 110 people sitting in amongst our rough sleeping population who need some kind of intensive housing support. Then we also have a couple of other categories in the system. The green light one at the bottom there is very much about people who can probably self-resolve or resolve with very limited interventions and support. And as you can see, it's a tiny, tiny number. The group in the middle are people who could potentially move into the private rental market with the right supports in place. I am going to whiz through, I'm going to actually skip some of these slides. I'm hoping you'll be able to get this slide deck after, so you'll be able to see some of the other information for context. Unsurprisingly, very male population. There's a couple of spots where I will stop because they tie back to some of the thinking I think we've had at the end, or that I present at the end around prevention as well. So obviously we have a population in Adelaide, unlike other cities in Australia, where a significant proportion of our group are Aboriginal people. And there is also a significant number of Aboriginal women amongst that group as well. So I think the Sears response is slightly higher than this kind of 35%. So we run at about 35 to 45-ish% of people on the streets being Aboriginal, and a relatively small number of remote visitors amongst that population, but you know, a group with significantly different needs in terms of cultural safety. The other group, one of the other groups I wanted to mention here are older people. So our list is not a very older person list by standard older person definition, so 65 plus. However, when you start looking at people who may be prematurely aging because they've been homeless and chronically homeless, we actually have significantly more people in that list who actually are potentially eligible for assistance through My Aged Care for premature aging. And their needs are obviously quite high acuity as well. So we go from having 2 people, say, in the September data capture that meet that normal standard older to 26% of people, if you look at that premature aging category. Obviously, we have other groups that we can identify in that list. We don't have a huge number of youth, but then we're only looking at one component of the youth kind of cohort, so the 18 to 24s, because the effort in Adelaide is very much about adult rough sleepers. Veterans, a fairly small number of people who self-report being having a veteran history. That data probably needs unpacking a little bit more, and not particularly culturally and linguistically diverse. I just want to briefly mention domestic and family violence. I don't think we have the best indicator of domestic and family violence in the list as it currently stands. So 31 people, but the alarming thing there, 100% high acuity. So you're talking about a group with really significant support needs. Disability, and Kim mentioned this in terms of the broader SEARS population. When you aggregate all the categories in the by name list that could indicate disability, so this is very broadly defined and also including mental health, about 116 people, so 78% of the list specify some level of disability. So obviously in terms of physical disability, that has some impact around housing needs, mental health disability, obviously also around broader support needs as well. And in the footer there, I just pull out the fact that 30% of the list specify they have a brain injury, and another 11% actually indicate that they may need some help with housing because of physical disability. If we just isolate mental health, 73% of people indicate mental health issues. And I also included a little breakdown there about Aboriginal and non-Indigenous there. And you can see that amongst the female Aboriginal population, very high rates of high acuity there. Okay, so inflow paths, which is also part of the picture. So, you know, we've got to understand people's needs so that we can help them in terms of exit points and provide the right supports in the system. But we've also got to look back at turning the tap off at the same time. So there's limited information in the VITADAT that gets to the inflow side of things, but some of what we have is actually very useful. So there is a question about where people were living prior to rough sleeping. And this data I find really interesting and a little frustrating because I'd like a little bit more information too. So before you were rough sleeping, where were you? 40% roughly living with family and friends, 30% in permanent housing of some type of tenure, that's the bit we don't know, and 9% of people citing direct movement from correctional facilities to the street. So there's also quite detailed and in-depth information in the by name list around what I've called here system touch points. So the kind of intersections that you can look at to start to think about where we might be able to provide different kinds of support that might make a difference to someone's pathway. So the tool asks things about presentations to accident and emergency, ambulance use, hospitalisations, including for mental health, corrections, as I mentioned, and then also experience of, you know, out-of-home care and other care facilities as well. So you can see from this very brief overview that we have fairly high service uses amongst the population of all of these kind of intersection points. And so there are clearly some opportunities there for prevention and working more closely with those sectors around this particular group. In terms of thinking about where to from here, and what our data actually starts to tell us in terms of fairly concrete evidence, for my mind, there's sort of three really key areas we need to focus on. One is obviously our Aboriginal population and what culturally appropriate responses look like for that group, which is very diverse and includes remote visitors, whose needs in Adelaide probably look more like needing something that's culturally safe and probably more temporary. And then we have a number of groups of people Aboriginal people who are actually looking for permanent housing and options that just don't exist in the system. So when you start looking at breaking that data down a little bit further, we see that there's quite a number of Aboriginal people sleeping on the streets that are 45 plus. So that's the premature ageing category for Aboriginal people under the My Aged Care system. So that starts to raise questions about, are we missing an Aboriginal specific aged care response in Adelaide? I would argue we are. We also have very high rates of disability amongst our Aboriginal population. So that raises questions then about how our Aboriginal rough sleeping population are intersecting with the NDIS, for example, which if any of you have played with is not super fun. We also have need, I think, just to look at aged care responses for our non-Indigenous population as well. And that ties back to that point I was making before about premature ageing and, you know, our group of friends on the street who are 50 plus and not Aboriginal. We also have a significant group of people, obviously, with presence of disability. And so that raises the issue around supported disability accommodation and what that system and market can offer, as well as the NDIS in terms of support too. In terms of inflow, there's clearly a role in place for improved, bolstered tenancy support. So if we've got 30% of people tipping in from some kind of permanent housing, what does that mean? I would argue that we need more brokerage money to support people into the private rental market if that's a suitable option for them, or also to avert the next crisis or the current crisis. Maybe something that looks like a time-limited rental subsidy. That's certainly been done in other jurisdictions and done quite well. As I mentioned before, we've got that information now and some clear evidence on touch points in the system. So health is one of those areas, and we already have some responses around health, and I think the COVID-19 pandemic response has very much shown the importance of health to that, to the whole system and how that can help. Corrections, so prisons, juvenile detention, and then the other care pathways and beyond. We're all very aware of the sort of raise the age campaigns around care leaving pathways and those kind of things, and those sorts of responses do make a significant difference to rough sleepers. I think we've still got a bit of work that we need to do unpacking that temporary living arrangement being with family and friends and what that means and why that breaks down, why people are there and what might change the pathways around that. And I guess my final point is, do we have the right housing and exit options for people moving on from rough sleeping in the system? And I would argue in some ways we do not. So much of what Kim was saying in terms of support is absolutely bang on. We need much more recognition of the importance of support for keeping people in housing. But we also need to understand that the housing options that are available at times are not the appropriate housing options. And in some ways you set people up for failure. And that's not what any of us want to do. So there's broader questions here for the system around what housing first looks like in the Adelaide context, what we're missing. And I would always argue that we need to look at what I would describe as soft institutions. And I don't mean institutions in the sense of the hard institutions of the past that we all know were horrible for many people, but institutions where people are safe and supported, have choice and dignity and control and all of those other things. So, Aboriginal appropriate aged care facilities, whatever that might look like. Whole range of discussions to be had, I think, in that space, but really important discussions.
Thank you, Selina. So Ian, that leads in very nicely to a question for you about how the other sectors actually are involved in the COVID-19 response.
Yeah, well, I guess in the early, when COVID first came, it was obviously a health initiated response. So, we've obviously been speaking a lot with SA Health, and I had lots of conversations even in the early days with the with mental health and the office of the chief psychiatrist, really just John Brayley, who knows the sector a little bit as well. So it was really just trying to work through, well, what sort of responses are going to take place. So look, there's, homelessness intersects with almost every part of our system, particularly within the health system, but as we know, also across justice and you name it, I guess it intersects with everything. So, yep, all I could probably say is we know that's going to be an ongoing issue for us as we move forward. I mean, I don't think I've said this before, even in my previous role, that homelessness doesn't just rely on just housing, it relies on the intersection of everything. So, look, we have a huge amount of work here within the authority, as the specialist homelessness services do as well. They intersect with a whole bunch of, not-for-profits in those sort of areas, as well as government. So, probably haven't really answered your question, Louise, other than saying we absolutely understand it's a massive issue, and I guess we're obviously moving forward with looking at homelessness into the future, and the touch points have been with almost everyone so far.
Reminds me of before yours and my time, Ian, of course, in the 1970s when there was the health in all policies. It really would be nice to see homelessness in all policies across government at this point. So, perhaps you can influence that from your spot in Saha.
I hope so in some degree. I mean, it's going to take some time, but it was really interesting in the first bit of the COVID where we were certainly at the lots of touch points, and then as COVID sort of expands, it seems like people get really busy. So things take a life of their own. But it's been a really I guess I've seen lots of positivity though within the sector, how they've embraced the some of the challenges in front of them as well. I've obviously worked in the sector for a long time, and certainly I didn't expect anything less than what we've seen as well in terms of a response. So I've liked the fact that government's been part of that process, but I guess the challenges for us as well moving forward is that we continue to do this, we continue to work together, continue to challenge each other as well. So an interesting thing too, just looking at interstate, and obviously we know we all probably feel for Melbourne at the moment what they'd be going through. But I read with interest the other day just Sydney, who I've touched base with a lot in the early days, and they've still got over 2,000 people in motel accommodation now. So we've worked really hard from a peak of just over 500 to bring that down, and with some supports and with housing, and yet they're at a point where I would think if we had 500 people still in motel accommodation, we'd say that's breaking point. So 2,000 people still without really a future is probably indicative of, in many ways, what the Zero Project's done. So certainly led from the front, and I think it's a real positive as well.
Yeah, and I think it's been good to see the alignment of the housing vacancies, and also a number of new developments that have started and will come online soon. So I know we do have a question around that. We do have a number of new developments that are being built through partnerships, particularly in the community housing provider sector. We do have one last question for you all, so I'm going to race around as time is getting late. How can we prevent homelessness after the pandemic based on what we've learned through this experience? Kim, I'm going to start with you.
Okay, thanks. What I saw COVID do was that it brought all parts of the system together really quickly with a sense of urgency around a common goal, and that was to move people off the street into emergency accommodation and keep them safe. People that were rough sleeping weren't invisible, and there was not this acceptance that I think can happen in our community and across our systems, that that we have to accept a level of homelessness, because we knew that there was a risk not only to the individuals that were sleeping rough, but also that has an impact for all of us, everyone across the community. So to solve homelessness, prevent homelessness, continue with the same level of urgency, continue to treat rough sleeping and homelessness without an acceptance that it is that we have to accept a level of this in our community. Continue with the same level of political will and taking a systems approach to it, because what we've demonstrated is with those two things, we can solve homelessness. It is possible, but it takes a lot of work, and it takes the political will and us all getting behind it in a systemic way to respond to it. Also, you know, obviously affordability, poverty, inadequate supply of housing and appropriate accommodation is an issue, but also we have people that are homeless and rough sleeping because our systems are fragmented. There are gaps, and these flow people into homelessness and rough sleeping. And we know that because we know the group that are sleeping rough, 25% are living with a disability, 82% are living with a mental illness that is preventing them retaining a tenancy. We also know one of the larger inflow points besides couch surfing and evictions is correction system. We know our colleagues in corrections and in health are also committed to putting people into permanent housing, but the system does not work for them. So if we continue with the way that we are working together and rectifying, integrating the system, then we can solve homelessness with not only houses and that housing first, permanent housing approach, but with a system that works and the appropriate supports around people, not just giving them a lease, a house and some financial counselling. People need a lot more than that to respond to all of the issues that have led them over a lifetime to rough sleeping.
Thank you, Kim. And of course, those stats on disability and mental health are self-reported as well, so it may well be an underestimation. Selina.
Yeah, I mean, I would echo much of what Kim just said then. I guess what I would add to that is using our data as the evidence base that we need to support what we know, alongside sector knowledge and lived experience views to really work out where we need to change the system and where we need to advocate for some things that are missing or some things that need to be done differently. You know, some of those areas are a pipeline of housing options would be lovely, so that we can do some sort of future planning as well, but also reorienting some of the housing stock that we have currently that we know just doesn't suit people's needs.
Thank you. And Ian?
It was probably very similar. I'd say just, you know, plan for the future by learning well from our experiences, both the positives and all the areas that we need to improve, compare and contrast with our colleagues in the state and overseas. You know, there's going to be a huge amount of learnings across the world in terms of the, you know, COVID responses, and we shouldn't forget about those things as well. We've done some things extraordinarily well here, but it'd be really interesting as well to see, you know, how do we compare and contrast overseas. And probably like everyone else, data. It certainly builds our evidence. One of the great things about the Adelaide Zero Project was actually gave us that opportunity to not only bring data in, but we know every single person who's on the streets, and that's a real positive thing. One of the interesting things coming into the authorities, I still know everyone out there, so you know, that's both been a positive and also be as a negative, because I'd love to see no one out there, but we've all got a role to play, and just keep looking at prevention as well. So Chicago talked about, I know Neami Brennan talked about prevention, and even simple things of having, I think she talked about $1,000 can prevent someone coming back within the system. So yeah, just keep looking at a whole range of preventative measures.
Thank you. Now we're running very, very close to time, so I'll thank everyone. Like to remind people who are on that the Foundation's hosting another webinar at 9:30 a.m. local time on Thursday morning, featuring Dr. Neami Brennan, who is the most recent Think in Residence in Adelaide, and Professor Chris Leishman from the University of Adelaide. And now, Jane, I would like to hand back to you. Thank you.
So, thank you very much, Louise. I was thinking, listening to those fabulous accounts from people who are really at the coalface here and working on Zero Project, that we were blessed to have had all this work, so we were COVID ready. The situation in the last 6 months would have been unthinkable if we hadn't had the name system in place, if we hadn't had the Zero Project going, and we hadn't had the collaboration. So hopefully we've made life easier for Saha, but also easier for all of the people involved in making sure they can make a difference. And I think if there's one word that we've got to listen to too often in the last 6 months, it's pivoting. Everyone's been pivoting, but you can't pivot if you're not on your toes. And I think that Adelaide Zero Project has had everyone on their toes, ready to pivot. So thank you, Louise, for hosting and managing the panel so cleverly, for the speakers for giving us insights into the facts, the experience, the data, and the way forward. I can't thank you enough for giving up your time. I should also acknowledge again the Capital City Committee and the generosity of the two universities, Flinders and Adelaide. I should point out there are a few questions that are lurking in the chat box. If there's anything that we haven't answered, we'll get back to you and we'll find you and track you down with those answers. If you'd like to look at this discussion again, it will be put up on the dunstan.org.au site, and you'll also see an opinion piece by Dr. John Falzon talking about this issue particularly. We'll also be releasing 3 reports in the next few days on health, housing and homelessness, and that's a collaboration between us and Wellbeing SA, the University of South Australia, and I hope you'll enjoy those documents. They're really enlightening. So finally, I'd like to remind you not to forget to register for the Global and Local Perspectives on Homelessness on Thursday. Have a great afternoon. Thank you for joining us. Goodbye.